Daily feeding tip. I'm working with an 8-year-old child who's a very picky eater. Previously, he worked with a therapist who worked on the oral motor mechanics of eating and swallowing. So for the last year since I've been seeing him, I've been focusing on the sensory aspects of eating. This child is extremely hypersensitive, both to smell, touch, and taste of foods. And currently he mostly just eats Goldfish and yogurts, and we've been working on trying to get like a nutritional balanced type of shake added in the morning. I do know that he's had some instances of throwing and gagging up. At times he's interested in exploring other foods and at times not. I don't really see any obvious chewing difficulty, but I do know that he doesn't move his tongue well and pockets foods. Do I continue focusing on the sensory aspects of eating, or should I back up and work on the oral motor components of eating? My suggestion would be that you do both. So when we look at the Pediatric Feeding Framework, our approach with feeding should be one that comprehensively supports all the child's feeding needs. Definitely we want to continue to encourage sensory and behavioral flexibility in this child's routines related to touch, smell, and sensory interactions with foods. But at the same time, if you don't add the oral motor assessment and make sure that our intervention encompasses looking at why physically he's having trouble with these behaviors with foods, then we're not going to have an effective long-term plan for him. So hit them both, but make sure you find your oral motor why. Thanks for watching. If you enjoyed today's daily feeding tip, be sure to click subscribe below to join the Peds Feeding Tribe YouTube channel to get more content just like this and hear all my daily feeding tips.